voice on the mental health aspects of abortion. This is part of VA's overall training series on reproductive health. Person who is pregnant is more inclusive language. However, many of the studies that exist to date have not so far included trans men or non-gender binary people identified as such.
Hello, my name is Emily Ashbaugh. My pronouns are she, her, and hers, and I'm really glad to be with you today. Some patients may be fearful, distrustful, or have preconceived beliefs related to reproductive health care, which may impact their decision-making based on their own experiences and the long history of reproductive injustice in this country.
Language has a profound impact on what people hear and learn. When discussing abortion, please use these examples of clinically accurate language. There are many ways the VA can provide abortions, including on-site with providers, ordering prescription medications, or performing abortion procedures in outpatient clinics and operating rooms where available.
VA also amended the regulations implementing the Civilian Health and Medical Program of the Department of Veterans Affairs, CHAMP VA, to remove the exclusion on abortion counseling and expand the circumstances under which abortions may be covered by CHAMP VA.
And another common reason that's relevant to our talk today is that a sizable number of women report that they're not emotionally or mentally prepared. In the immediate aftermath of seeking an abortion, those who were denied abortion compared to those who received it felt a lot more negative emotions, more regret, anxiety, and anger in particular. It is important to note that maternal bonding difficulty is substantially more likely after being denied an abortion. Now she feels helpless. She doesn't want to kill herself, but she feels like her life plans have been squashed, like she really has no options. Not only did most women have to pay for their transportation, but they had to pay for accommodations if they needed to stay overnight. The next most common reactions were negative, most notably sadness, guilt, or feeling upset. Nearly half reported not being at all upset when seeing protesters. Abortion restrictions, by contrast, can substantially curtail future life prospects. And among veterans, having a mental health diagnosis is associated with a greater likelihood of an unintended pregnancy. Using the word want is often painful for people who experience that. So in addition to not using the word baby unless the veteran prefers the word baby, in the case of decisions about eligibility for VA-provided abortions, multidisciplinary decisions among clinical teams can really boost people's confidence when these decisions are consensual. Dr. Martin had validated and normalized her feelings and was interested in hearing more. In this case, some of the emotional advantages might include the privacy of being at home and not feeling like anything invasive is happening. Because of high proportions of risk factors like mental health burden, military sexual trauma, intimate partner violence, racial inequity, endorsing more myths about abortion has been found to correlate with more difficulty in making a decision. It's also the case that when the partner is uncertain or when the partner is actively opposed to abortion, that has been found to correlate with more difficulty making a decision. Those who are in that situation rarely regret the decision. They do have more post-abortion distress than people who immediately knew that they wanted to have an abortion. So regarding continuing with pregnancy and parenting, she thought that that might make her feel more purpose in life and maybe bring her and her partner Carter closer to one another.